Welcome, everybody, to Connecting the Dots, Truth Bombs. Okay, I want to ask you a question. We have 5 minutes to really hear something and then hopefully take action. I want to ask you, if you heard this, how would it make you feel? Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary and therefore not payable. Did you hear what I had to say? That is the Medicare platform, and all other insurance companies follow. So if you live your life only doing for yourself what your insurance company is willing to pay for, you are not going to get healthy. You are not going to get where you want to go. Where do you want to go? I understand insurance. I understand that you pay some pretty premiums every month. So do I. But here's the reality. I can't even remember the last time I ever used insurance. I can remember the last time I was on a prescription, which was when I was in my 20s, and I'm 65 years old. I had some acne and I took an antibiotic that made me sick to my stomach, and I stopped. I have not been on any prescriptive medication since then. Is that your story? What do you do with your health? Who manages your health? And yes, sometimes we have to do a lot of research to figure out what it is that we are actually paying for. Now, some of us may not have many options because you work for a company and this is the only insurance that they offer. So start talking to your company. See if you can become part of the action that begins to look at another way so that people can actually get some form of insurance that will actually provide health care. I just 2025, when I turned 65, I did get Medicare, just because if you're ever going to have it, you got to get it when you're 65, or guess what? You're going to get penalized. So in that, I also kept my insurance with Liberty Health Share because I always want the option to go in the direction that I want. So I do have a premium with Medicare and I do have a premium with Liberty Health Share, but I make decisions about my health, about what it is that I'm going to use it for, because this is the only real insurance that I have. Is my health. And that's really the only insurance that you have, is your health. And health, as I just read, is not even acceptable in the Medicare model. So we do have to step out of that and do things differently. And the first thing that we have to do is we have to start looking at our own lifestyles. I want to just highlight a couple of words to you. And I want you to ask yourself, do you have any of these problems? Chronic stress, no time, poor diet, lack of exercise, brain fog, memory issues, headache. Now, there's about 20 on each slide, but I'm just going to highlight feeling cold hands and feet, fears, shaky with missed meal, bowel disruption, dry skin, mood swings, unstable behavior. If you put a name on anything that you're going through, it's chronic. And when you have a chronic problem, it impacts your brain. And it literally takes up real estate and it takes away from you things that maybe you did when you were younger or that you just can't get around to doing now. You are surrendering valuable gray matter to those chronic stress patterns. And if you want to make a difference, you're going to have to step out of the hamster wheel. You're going to have to take new steps, and you're going to have to do things differently. Connect My Brain has a plan, mechanical, chemical brain, and we can coach you and we can help you every step of the way. What we need from you is a high level of commitment. If you are ready to take action, reach out, connectmybrain.com. Be blessed.